and welcome to Live with Dr. Amanda. I'm Dr. Amanda and it's time for another Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. And don't forget, if you haven't already, hit the subscribe button, it's completely free. Today we're going to be talking all about asthma. So asthma is an extremely common condition. If you don't have it yourself, you probably know somebody that does. Maybe it's a relative or a friend or someone that you know from work or school. In the UK, there's about 5.4 million people that suffer with the disease. That's 1 in 11 children and 1 in 12 adults. Like I said, it's extremely common. It often runs in families and sometimes it can come hand in hand with other conditions which are eczema and hay fever. Now, although it's very common, there's lots of people that have it, the severity of it will really depend on the person and the situation they're in life. For example, in pregnancy, sometimes asthma can get worse, but it can also get better as well. Now, there's so much to speak about when it comes to asthma, how to control it, how to diagnose it, and all the different kinds of inhalers, how to manage an asthma attack. There's a lot, and I'm not going to be able to cover all of that in this one video. But what this video is here is maybe as a part 1 to this conversation about asthma. In my work as a GP, I deal with a lot of people that have asthma. And I see so many people that aren't controlling their asthma well. And a lot of it is because there isn't enough education to understand what well-controlled asthma is. There's lots of people, and you might be one of them out there, who's suffering with asthma and think that the symptoms that you're having are just part and parcel of the disease and it can't be improved. But that's why this video is here today, to talk about what is well-controlled asthma. Before we get into that, maybe we should define what asthma is. So asthma is a long-term airway condition. It's usually characterised with 3 symptoms: coughing, wheezing and breathlessness. And those symptoms fluctuate throughout the year, throughout the day. So someone with asthma has very sensitive airways. Airways that are inflamed and they're ready to react to different triggers. Now, triggers can depend on person to person, but very common ones are things like laughing, like a lot of emotion or crying a lot. Also, exercise can trigger it, infections can trigger it, and some allergies for different people. Now, once the airways are exposed to that kind of trigger, that's when the inflammatory process really starts to ramp up. And there's a number of things that happens to the airways. First of all, the airways, they're actually surrounded by muscle, and those muscles become very tight. Also, the lining of the airway becomes quite inflamed and swollen, which reduces the space even more. And in some cases, there can be a build-up of mucus as well inside the airways. So all these things together make it very tight and narrow and really difficult to breathe. A lot of the time, these episodes will settle down with some simple treatment, but sometimes they can go on to go to a full-blown asthma attack. And actually, there are some asthma attacks that can still be fatal. Because asthma is so common and so well heard about, and so many people have experienced it and know people with asthma, sometimes it can be trivialised and not really understood what the significance and severity that asthma can be. Now, in the last 30 years, there's been so much more education, understanding about asthma, and the management has really improved. And because of that, the number of fatalities and deaths that have come from asthma have reduced, to a massive degree. However, there are still 3 people every day that die from asthma, and 2 out of those 3 people usually could have been prevented by better asthma care. Now, if your asthma isn't being treated well, not only does it mean that you struggle day to day with your symptoms, it also means that you're at higher risk of having more asthma attacks. And the more asthma attacks that you have, the more damage that there is to the airways, and the higher risk that there is that you may have a fatal asthma attack one day. And this is why this next part of the video is really important, and this is the take-home points that I want you to remember. So, first of all, it's defining what is well-controlled asthma. There are 5 elements to defining if someone has well-controlled asthma. And although it is a lifelong condition, we can manage it to the point where your asthma isn't affecting you every day. So pay attention now to these 5. So the first is no daytime symptoms. So that means not really feeling that you have asthma during the day. That means no wheezing, no coughing, especially when you are well. The second is no nighttime symptoms and not being woken up by your asthma. So not struggling with your asthma to the point where you're coughing through the night and you're not getting enough sleep. Number 3 is no asthma attacks. That is the aim of treating asthma, so that you don't have any asthma attacks. And number 4 is that your asthma does not prevent you from doing day-to-day activities, and that includes sports. And number 5 is very limited use of the reliever inhaler. Now, if you are an asthmatic or you know anyone with asthma, you know that the bread and butter of controlling asthma is the use of inhalers. And there are 2 different kind of camps of inhaler. There are ones that relieve the symptoms when they come on, when you're feeling that tight chestedness, and there's also ones that prevent symptoms from occurring in the first place. Those are the ones that you take every day on a regular basis. Now, that relieving inhaler, the first one I spoke about, a lot of people have a blue inhaler called salbutamol. And although it does relieve symptoms, really we want you to the point where you're not having symptoms to relieve. And so that blue inhaler usually has about 200 doses in it, and that should last somebody an entire year if their asthma is well controlled. Now, I do repeat prescriptions and I get requests for blue inhalers month after month after month, which shows that the asthma is not well controlled. When I say limited use, you shouldn't be using your blue inhaler really more than twice a week. So those are the 5 things. I'm going to repeat them again. So no nighttime symptoms, no daytime symptoms, no asthma attacks, no effect on your day-to-day activities, and very limited use of your reliever inhaler. Now, if you're not able to go through that list and tick all 5 of them, it means that your asthma is not well enough controlled. There will be times where your asthma may flare up, say you've done some very strenuous exercise, maybe you ran a marathon or something like that, then yes, you do have a lung condition, and so you may feel more breathless then and need to use your reliever inhaler. Or say you've got a chest infection, it's winter, then yes, you may need to use it a bit more then. But overall, you should be able to tick all 5 of those. And if you don't, please go and make an appointment with your GP. Now, the second important point in this video is about how to actually manage asthma. So many people that I know use their reliever inhaler as their main way of treating asthma. Now, I said at the beginning of the video that asthma is an inflammatory condition. There's inflammation in the airways. And so to treat the condition, you need to have something that is anti-inflammatory. The things that are in reliever inhalers, salbutamol, do not treat inflammation. They do help to open up the airways when you're having an asthma attack or you're experiencing those symptoms, but they do not treat the underlying cause. The way in which we treat the underlying cause is usually with steroid inhalers. Those steroids have anti-inflammatory properties, and I know a lot of people have worries about using steroids long term, but the risks of using steroids in an inhaler compared to tablets or to cream really are so reduced. And the biggest problem that most people have, if they're going to get any side effects from their steroid inhaler, will be getting some thrush in the mouth, which actually can be treated and can be prevented as well. So I really urge you to please use your steroid inhaler. I know lots of people, because they feel the relief from their reliever inhaler, they rely on that and don't take the steroid one every day. But taking that steroid inhaler every day, usually twice a day, can massively change the state in which your airways are and can get you to ticking off all those 5 points that I spoke about before. Now, that steroid inhaler is really only the tip of the iceberg when it comes to controlling asthma, but the majority of people will see a vast improvement when they're on the right dose of a steroid inhaler. There's lots more treatments out there if the steroid inhaler isn't quite getting you to tick all those 5 areas. And so you should always go and see your GP if you find that your asthma isn't well controlled. But that's really for another video to explore more about how we control asthma. I really hope this video has helped, and please sit down and speak to your loved ones if they're ones that have asthma. Share this video with them and look through those 5 points. If they're not all ticked, make an appointment with your doctor today. Thank you so much for watching, and don't forget to like, subscribe and share. All those things are completely free, but they really help the channel and help more people to see this content. Also, thank you for sticking around, those of you that have subscribed and come back. I know we've had a little break from Medicine Mondays, but it's because I started a new job and I just needed some time to adjust to the new schedule, but we're back. And please, if there are any topics that you want me to talk about, any burning questions that you have, you can leave them down below. You can go and see me on Instagram and send me a personal message, a DM, or you can send me an email to Life with Dr. Amanda. All my handles are Life with Dr. Amanda, and my email is lifewithdramanda@gmail.com. Thank you so much for watching, and take care.